Hi everyone, welcome to Dr. Ties, your medical expertise whenever you want. Please note that this is strictly for educational purposes and not intended for a formal diagnosis or treatment. No medication or remedy should ever be given to anyone without consulting a doctor and checking for allergies first. Today's topic is ADHD or attention deficit hyperactivity disorder in children. ADHD is a condition that affects children's behavior and is characterized by inattention and hyperactivity. Children with ADHD usually have hyperactivity where they are always on the move and have difficulties with concentration and paying attention. They can have habitual lateness, forget things, not listen to others, interrupt others while they're talking, have impatience and sleep problems, and trouble making friends. The symptoms of ADHD may be noticed at an early age, and they usually tend to become more noticeable as the child grows older and starts school. Although the diagnosis is usually made before the age of 12, some children are diagnosed later in childhood or as an adult. The symptoms of ADHD may improve with age, but if the diagnosis was made at a young age, the individual can continue to have difficulties in adulthood. It should be noted that being inattentive, hyperactive and restless at times does not mean ADHD. This could be a normal variation or phase that many children go through as they are growing. The exact cause of ADHD is not fully known, but it runs in families, suggesting a possible genetic cause. There are other factors that are thought to increase the risk, and these include prematurity before the 37th week of gestation, having low birth weight, and smoking, alcohol or drug abuse during pregnancy. ADHD is also more common in people with learning difficulties. There is currently no cure for ADHD, but there are various treatments and therapies that can help children with difficult behavior. The management involves various therapies, medication, educational support, and other types of support for children and parents. Appropriate support and education for the affected child and their parents can be very helpful, as looking after a child with ADHD can be challenging. Psychoeducation is a common approach where affected child and their parents talk about ADHD and its effects. This is thought to help to cope and live with this condition. Behavioral therapy usually involves behavior management and is based on a system of rewards to encourage the child to try to control their ADHD. Tailored parent training and education programs can help parents on how best to interact, talk and play with a child who has ADHD. CBT or cognitive behavioral therapy can be considered for some children, and this is aimed at trying to change how a child feels about a situation to improve the problem behavior. A combination of medication and therapy can be more suitable for some children so that they can cope better with their daily life. The treatment with medication is usually initiated by a pediatrician or child psychiatrist. The medications used to treat ADHD do not provide permanent cure and are aimed at helping children concentrate better, be less impulsive, feel calmer, and learn and practice new skills. It is normal to start with a small dose of medication and build on this as needed. Some medications need to be taken every day while others are taken just on school days. In terms of natural remedies, there is no strong evidence that they work. Children with ADHD should have a healthy and balanced diet. If a link is found between types of food and worsening ADHD symptoms, these should be avoided and discussed with a doctor. Some studies suggest that supplements of omega-3 and omega-6 fatty acids can be beneficial for people with ADHD, but these may not work for everybody. If it is suspected that a child might be showing symptoms of ADHD, it is advisable to see a doctor in person for proper diagnosis as early as possible so that the appropriate support and education can be given.